are going to look at the Horner syndrome. So what is this Horner syndrome? So the Horner syndrome, it occurs due to the oculosympathetic paresis. So it is a oculosympathetic paresis. It is due to the ocular sympathetic paresis, and it has something known as a triad. So what does this triad include? So triad, it includes, there is something known as the mild ptosis. So mild ptosis, what is it due to? It is due to the paralysis. Ptosis is the paralysis of the Muller's muscle. So the Muller's muscle, if you see, it is involved in the mild ptosis. Next, there is something known as the meiosis. So meiosis is nothing but, as you know, is a constriction of the pupil, and this is nothing but due to the paralysis. So paralysis of what? The DP, there is a dilated pupillae. So we have seen the triad, we have seen the two components. Now the third component what we see is nothing but there is the reduced. There is a reduced ipsilateral. There is a reduced ipsilateral sweating. There is a reduced ipsilateral sweating, and this in common terms is known as the anhidrosis. So what are the other features of the Horner syndrome? So let's look at them. So the other features, it includes, there is mild. There is the mild enophthalmos. There is the mild enophthalmos. And next there is also the loss. There is loss of the ciliospinal reflex. Loss of the ciliospinal reflex. Next there is heterochromia. There is heterochromia. So what is meant by heterochromia? It is the ipsilateral iris is lighter in color. It means that the ipsilateral, or in short we can write IL, ipsilateral is lighter in color. Lighter in color. And then there is also another point, that is the pupil is slow. The pupil, if you see, it is slow to dilate. It is slow to dilate. And there occurs slight elevation of the lower eyelid. There is slight elevation. There is slight elevation of the lower eyelid. Next, we are going to look at something known as a cocaine test. So what is meant by cocaine test? Cocaine test is about 2 to 4%. And there are small pupils. There are the small pupils, if you see, they fail to dilate in Horner syndrome. So it fail to dilate in Horner syndrome. So other thing to note is that in case of the congenital Horner syndrome, so in case of the congenital Horner syndrome, so here the additional features are seen. They are the heterochromia. The heterochromia iridis. The heterochromia iridis. The next feature that is seen is the unilateral straight hair. Straight hair. So unilateral straight hair as well as the heterochromia iridis. So this was completely about the Horner syndrome. To learn and grow daily like this, please do subscribe.